Okay, in this part of the pre-taped video lectures, I would like to talk about the health of reproductive system, and to be specific, the female reproductive system. Let's take a look at the female reproductive system. As you can see on the side, we have the ovaries. Ovaries are the place of the ripening and maturation process takes place for the eggs. And after going through the puberty, which usually, if you take a look at the books, usually they give you a time at the age of 12, 13. But based on some scientific literature, it indicates that there is a direct relationship between the time or age of the puberty and the place that you live. Meaning that if you are living in a warm climate, it is possible that you go through the puberty early on in life versus if you are living in a cooler climate, such as if you're living in Alaska, the time of the puberty or the age of the puberty will increase. And so anyways, whatever the case might be, the body gets the message. And inside the ovaries, when the puberty happens, then there is a production of a hormone in the body called follicle stimulating hormone, or abbreviated as FSH. And this, obviously, the follicle stimulating hormone does what follicle stimulating hormone should do, meaning it stimulates a growth of a follicle. So if you are looking at inside the ovaries, imagine that if you have a follicle and this starts to grow, and as it grows larger, there is more secretion of the hormones, and it gets to a point that it grows larger and larger, and finally it gets to a point that completely the egg is ripened and it's getting ready to be released. Remember that females are born with the set number of eggs, meaning every time that they have a cycle and they are releasing an egg, practically they are getting closer and closer to the, to becoming or going through the menopause. And by the way, having said menopause, it is interesting to know that, for example, in the United States or in the European countries, we hear so much about the side effects of going through the menopause. Or in a male case, it is called andropause. But the side effects of menopause in females, such as hot flashes, insomnia, osteoporosis, which is loss of the minerals from your bone structure, and happens. And Western women, they experience more side effects of menopause than females that they live, for example, in Japan or in China. And for instance, in Japan, do you know that they don't even have a word for hot flashes? They don't experience that. And the reason that the females in those countries, they don't experience the side effects of menopause is not because they have a special ritual, is because the way that they eat. In Western countries, people, they have a tendency of eating more meats, especially red meats, and that is a contributing factor on experiencing the side effects of menopause, more so than the countries that they eat more seafood and they have ample supply of the omega-3 and omega-6 and omega-9 fatty acids in their body. Also, moreover, we know that, for example, quercetin or prunitine, which exists in prunes, quercetin in onions and garlics, or resveratrol in grapes, they are a phytonutrients that they help female not to experience the side effects of menopause. So practically, if you start changing your eating habits and you start intaking less red meat and more go toward the fruits and vegetables, and also especially the the phytonutrients that they can be helpful in that process, then you can reduce the side effects of menopause. And going back to the female reproductive system again, is that when the follicle or the egg or the ovum is released to the fallopian tube, you have to remember that fallopian tube is thinner than your hair. And it doesn't, this egg doesn't increase in size until it gets inside the uterus. And uterus is a pear-shaped muscle that practically it is the place, nesting place for a fertilized egg, if you will, in the future. So as the egg is released from the ovary inside the fallopian tube, it starts tumbling around. It takes a while, even though it is a very short distance. However, it takes a time for an egg to tumble and then go through the fallopian tube and get inside the uterus. Pregnancy always happens inside the fallopian tubes, meaning that the sperms, if they were successful, and if you remember from the previous video, they have traveled and they have gone through the problems and situations, and they have lost lots of, their, other sperms. And finally, some of them that they are really lucky and they have fought all the way up, then they get to the egg. And then, if they are lucky enough, as I mentioned in the previous video, and they still have the enzymes at the tip of their head, then they get to the egg. And as they get to the egg, they start, going all around the egg, and then that enzyme works as a key, and then opens up the membrane of an egg. And remember, when we talk about membrane is made out of phospholipids. In reality, it is kind of open, but closed with, the change of the chemical structure or the chemical compounds that exist in this membrane. And as the sperm and the enzyme works, then opens up the membrane, and the ovum accepts the head of the sperm. But as soon as the genetical material is inside the egg, it cuts off the tail. So the tail is cut off, and at that second, or even less than a second, I don't know what fraction of a second, the chemical structure of the membrane changes. So practically, it makes it impermeable, unaccessible for the other sperms. Even if you have other sperms, in the area, they are not going to be capable, even if they have the enzymes, even if they have the key, they are not going to be capable of entering the egg. So before going and explaining that what happens inside the egg, let me explain a little bit about the female reproductive system. As I've mentioned before, you have the uterus. Inside the uterus, usually, every month there is a production of what we call an endometrium lining, and changes happen in the body based on the hormones that is produced. The female body starts increases a hormone in the body called neoangiogenesis. And neoangiogenesis, it is responsible to produce more blood vessels. And when it does, as a matter of fact, because of increase in the hormone secretions in the female body starts absorbing more water and retaining more water. And also it starts facilitating the use of the iron, because the two things that the female body needs to build more blood is the water, the iron, and then the proteins. That is the reason that most of the females, over and above 85% of the females in the United States, they are iron deficient due to the fact that they don't have enough or they don't take enough food supplies that contains iron. And that's why after a while they end up having a problem such as low blood pressure, headaches, severe headaches at the time of the cycles, and numbness of the legs, numbness of the fingers and toes, and pale color. Those are all indications that there is a deficiency going on. So when the endometrium lining starts being produced inside the uterus, the reason for that is that is going to be the nesting place for a fertilized egg. So egg, after being fertilized and going back again to the egg, after accepting the genetical message, if you will, that is delivered by sperm, then practically, and after cutting the tail, the head of the sperm is going to rise like a loaf of a bread. When you bake a bread, it rises, and that's what's going to happen. It's going to rise, and it's going to get to the point that it's going to explode and release the genetical information. As soon as you have the you know, the released information, genetical information diffused with the genetical information of a female, then that is the time that you have the conception. And as the conception happens, then the first thing that you're going to see is the division. It's going to start dividing in a very rapid and fast pace. However, even though the division of the cells is going to take place, however, the size is not going to change, because if the size changes, then it is very, very dangerous for the female reproductive system. And as a matter of fact, make sure that you know the answer for this question: what is an ectopic pregnancy? Ectopic pregnancy is when the word ecta means out of place, and ectopic pregnancy means a pregnancy out of place, meaning that the fertilized egg is nested any place but inside the uterus, because the right place for an egg to nest is the uterus. If it nests any place else, then you have an ectopic pregnancy. Remember that this is very dangerous for the mother. So if there is a pain, abdominal pain, you know, changes in the blood pressure, especially, you know, dropping the blood pressure, and you know, seeing or having some you know, bloody discharges, and especially severe abdominal pain, then immediately, you know, if you suspect a ectopic pregnancy, immediately the person has to be taken to the hospital and taken care of, otherwise it might prove to be fatal. So, but usually in the healthy pregnancies, then after the fertilized egg is going to tumble down and is going to come inside the uterus and nest in the endometrium lining, or over and above the endometrium lining. And sometimes people ask me a question that how the fertilized egg is feeding itself before producing the umbilical cord, or having the umbilical cord to help the fertilized egg to get the nourishment from the mother's body. And that relies on the food supply that the egg carries with itself. If you take a look at, for example, chicken egg, you will see that you have the white part and you have the yolk part, and then you have a little bubble, air bubble at the end, and practically attached to the yolk, you see a little white strings that in reality, those strings are the genetical information. The rest is all food. Well, egg white being the best quality protein in the world, and you know, egg yolk containing lots of nutrients. So practically, if you take a look at the chicken egg, it's mostly food. And then the genetical information. And the same phenomena happens in the human reproduction you know, process. And the egg has the nourishments, and using those nourishments, it's kind of takes care of itself until the time that the umbilical cord is developed, and then it gets the nourishment using the umbilical cord. And one thing that we should remember is that when we get to the point of learning the you know, the contraception, then whatever that we do to facilitate the conception, we can do it in reverse to prevent the pregnancy from happening. And for example, the days method, at the day that we have a release of an egg, that day the body temperature changes. So sometimes they recommend that if you want to induce a pregnancy or to have a successful pregnancy, you should be aware of you know, your cycle days, and then at that particular day that you know that's the ovulation day, then you should measure the body temperature to make sure that you, at the time of the release of an egg, even though the changes are so minute, but still, if you pay attention and if you do the measurements, then you will figure out that what is the exact time of the release. So you can plan for that time, and also that can be successfully planned for the people that they are in the intimate relationships or the committed relationships, and they don't want to use any type of you know, contraceptive pills or contraceptive hormones or contraceptive methods, but they want to follow the days method. And then also we should realize that our eating habits, you know, everything that you eat or drink, such as alcohol, use of the drugs, it has a tremendous effect on the health of the reproductive system, ovum, and the sperms. Thank you.